In early April, I sent out an urgent plea on Facebook. My building needs supplies for COVID. We need masks, hand sanitizer, gloves, cleaning supplies. We're running out, and management says they're on back order. I tried getting items from Lifelong, but none are available. I live in a building for people living with AIDS. Several of us are older, and most of us have other health issues, so if we get COVID, we will die. Please contact me if you can help. My heart was racing as I posted. I hated putting myself out there vulnerable and scared, but I had to do something. I was concerned for my building mates in a way that I hadn't experienced since the early 90s, when so many members of my community were dying of another pandemic, HIV/AIDS. It was terrifying to open the Seattle Gay News obituaries, never knowing which or how many of your friends would be listed there. In April, when I tested positive in April of '93, after months of fighting fatigue and a sore throat, the fear became even more personal. Being positive for me was a double death sentence. It meant my partner of 6 years had been cheating on me. How long had he been lying to me, I wondered. I alternated between anger, self-loathing, and fear. How long did I even have to live? Could I outlive my parents? How would I begin dating again? These questions kept me awake at night and sometimes kept me in bed in the morning, depressed and ashamed. My lifeline came in 6 months later in the form of Seattle AIDS Support Group. It felt good to be in a room full of people with HIV/AIDS, sharing our stories, listening to one another, knowing we were all in the same boat. We allowed ourselves to be vulnerable with one another. These meetings were emotionally draining, and so after each one, we'd give each other long hugs, holding one another through the pain. This physical contact was so important, helping me feel less isolated and alone. Eventually, I began to forgive myself, and the self-loathing was replaced with compassion for myself and others. Lately, I'd stopped living with the fear of friends, loved ones, or acquaintances dying in high numbers. I'd relaxed into a more normal life, no longer traumatized by so many deaths close together all at one time. I remember a conversation I had with my mom back in '07, she lived in an elder care facility, a place that allowed her to be social and active, living around other people her age. I'm feeling sad today. We lost 3 people this month, and one the month before. She sounded tired and down. It's hard to explain to others when there are so many people dying all at once like that. It takes a toll. She sighed, nearly crying, yet fighting back her tears. "Yeah, Mom, I know. Sorry to hear about that," I said, while fighting back my own tears. "I know you understand. At least here we're all old. Back then you all were mostly so young," she said. What a thing to have to go through at such a young age. We both began crying for the loss she's feeling and for the loss I had in my past. Now today, during COVID, I'm not ready for a large number of people to be dying all at once again. The building I live in was created in '94 through the cooperation of AIDS Housing of Washington, HUD, and the City of Seattle to provide housing for people living with AIDS. Due to stigma and fear of people with AIDS, we were sometimes abused in our own homes, being bullied, ignored, spit on, yelled at, and despised. This building has been such a safe space, a community, and suddenly with COVID, we're not able to even be in the same room. There is once again a feeling of isolation and loneliness. The only bright spot is that since everyone is impacted, there isn't the same stigma with COVID that there is with HIV. We are once again facing the terror of death, though. Being immunocompromised and seniors with other health issues were vulnerable. A few minutes after posting my request on Facebook, the responses began pouring in. A couple of people offered to buy or sew cloth masks. Others offered hand sanitizers in bulk. Others offered Clorox wipes. Friends even promised to drop the items off. It was wonderful to feel so cared for and supported. Within an hour, 10 or more people were helping our building, and dozens more posted thumbs up and heart emojis. Sure, there were a few negative responses, but each time I deleted one, I basked in the abundance and love that has been showered on me and all the residents in my building. I realized that although I felt helpless against COVID, none of us are alone.